hypertension. Let's dive right into it. There's a lot to talk about, and we know there's hypertension, one of the top three conditions in North America. That's why we need to know this so well. I bet you will always have patients that come to your office, to your clinic, that says, hey, I have hypertension. I am taking this drug. And you will be able to make notes now because you know that the dental conditions related to this, why this happens, and what else you can do for the patient. So, hypertension, there are many drug categories, and it's really important to understand which category they belong to in order to understand the side effects, because not all hypertension have the same side effects. So the main categories are here. So there are a diuretic, beta blocker, calcium channel blocker, ACE inhibitors, and ARB. They end with OL, DIE, tin, April, Pril, pine. Now, which one is which, right? I'm pretty sure you see questions like that in your school examination. Now, let's memorize it for good. And whenever I do this for school presentation or even professional presentation for dental hygienists, they love it because it's so easy to remember once I tell you how to memorize this. Okay, so let me go back because I made a mistake. Okay, let's do it together. So OL, I'm actually going to take a blood over here. What I'm going to do is I'm going to turn into a D and a D. Can you see that you can put them together and put a D and a D? And now I'm going to turn it. It's going to be like opposite mirror image, a B and a B. And that's give you beta blocker. Easy, right? Awesome. Let's continue. IDE. Some like furosemide. So I take the ID out of it. I turn it like a mirror image again, and then I say DI. There's only one type of drug that starts with the DI in hypertension, that is diuretic. Diuretic. Awesome. It's easy, right? 10. Okay, let's do 10. 10, we have, those are 10, for example. Well, I think about 10, I think about my arm is 10. Let's say I did a spray tan on my arm because I'm going to wear some sort of tank top and I want it to just look good. So arm is 10, and arm is close enough to give you, it is an ARB. Now another thing you can do, which I don't often use just because I don't want to put any race out there, but another good way to say our era is 10. Right, we all have different skin tone, and Arabs are more likely just to be a little darker. And again, I don't want to generalize, that's why I don't exactly use this example, but this is another way to use it. So this is wake up memory. It doesn't have to be exact, it just needs to be good enough trigger so you can get to the correct answer. Something Pril, like lisinopril. I'm going to put an A in front of Pril. What does that give you? April, right? April is going to be A, gives me, you know when you have a card deck and A is the A, so that's going to give me a clue for ACE inhibitors. Something pine. Okay? Amlodipine, pine, for example. That is PINE. And I think about this story that I had when I was in California. California, I love the landscape because, I mean, they have everything from water to mountain, to the desert, everything, right? So pine, PINE. And I think about California because I've seen some amazing pine trees. I love going to the Lake Tahoe over there for skiing, for example. So that is California. That gives me what is CAL, calcium channel blocker. How simple is that? Now, if I ask you something 10, what it is, you know that it is a ARB. If I tell you pine, you know now California, calcium channel blocker, immediate, right? So this is how you memorize it. This is wake up memory. And I do this again for students and professionals, and this really sticks. I bet you're going to know this for the rest of your life. All right, let's continue here. So we have our hypertensive agents over here. We have many different categories. We've seen them over here, but what we really need to know is how we are going to be careful around our patients who are taking hypertension drugs. One thing that really may happen is common side effect is postural hypotension or orthostatic hypertension, meaning that when the patient gets up too fast or too slow, too fast, they might have slight dizziness. And you don't want that. You don't want the patient to have dizziness, so that's why you bring them up slowly. You rest them, okay, before they get up, and that is hypotension. The reason why they get hypotension is because the drug is used. So the patient has hypertension, and you give this drug to calm them down, to calm their blood vessels, but on the opposite side, it is going to rest it a little too much, and it's not pumping enough. Just like, when I take a Benadryl, I do it because I want to get over my allergies, but at the same time, it's going to make me sleepy. So there's always a side effect with a drug. This is a really important key part that I'm going to highlight it like that because this is, for me, a board alert. Okay, let's continue. Now we have diuretic. So let's talk with diuretic. Diuretic is how it actually works. Is remember I talked about the kidney before in pharmacokinetics. So it filters the water, and that by doing that it produces urine. But with diuretic, it just excretes more water out of the body. So let's say this was a tube, and there's a lot of tension because there's a lot of water. This is basically your blood vessel. But when you take water out, you have less tension. That's why it's preventing hypertension. That's how a diuretic works. And that's why it is also called a water belt, because it controls the water. Not by controlling water per se, but by blocking the sodium reuptake in the kidneys.
I've been using it. Thank you.
This is called the first line of defense for this type of drug. For this hypertension. Okay, so if your patient comes to you and they're taking diuretic, you just remember it's the first line of drug, and from there the doctor might try many different kinds of drugs, but you might understand that they started to have hypertension, they've just been diagnosed. And some names here, IDE, you can identify them now, right? Perfect. Now beta blockers are different. They produce the same effect at the end of the day, which is reduce the blood pressure, but it works very, very differently. It reduces the cardiac output. So the heart, I like to think about it as the pump or the engine. It really makes everything going. And you want it to decrease output, meaning it's not going to be as strong. The force is a little less, which is good because you don't want to burst the blood vessel. They are really, really tense already. They have a lot of pressure built up everywhere. Now, how does that work? Well, they are non-selective and also some selective beta blockers. So selective means that it is going to bind, and I talked to you again about the key and the doors, but it is more selective in where it is going to be versus a non-selective kind of just goes everywhere. We're just trying to put like the solution, and it's going to try to open every single door. It's going everywhere in the body. That's kind of the analogy that I would like to use. So there are some things we need to know about beta blockers, right? Because blockers mean that there's a receptor there. So let's talk about the receptor. Beta 1 receptor and beta 2 receptor. So beta 1 receptor, okay, let's say this is the beta 1 door. When it's open, it increases the heart muscle condition. How do I know it's the heart? Well, I say one heart. We only have one heart, right? Now beta 2, the door, beta 2, two doors. Two lungs. We have two lungs, right? So that's why I remember beta 1 is for the heart, beta 2 is for the lungs. Now, I also think about this. Which one is contraction and which one is relaxation? So the heart, I just think about it is contracting. It is contracting so much that it turns into something really, really hard, like a stone, like a heart, but that's made of stone, or cold heart. Okay, it's contracted so much. And then lungs, I would like to think about, this is a weird image, okay? The weirder the better, the one without memory. Think about, I don't know, boiling lungs, like it melts. It's so hot that it's melting. I know it sounds so weird. You probably won't see it ever in your life and you don't want to, but if you have this image in your head once, you'll never forget. So melting lungs, and for me, that kind of just translates to something that dilates, that is just a little looser. So that's relaxing. So that's how I remember beta 2 receptors are about relaxing the brachial smooth muscles, and beta 1 is about increasing heart muscle contractions. And we talked about a selective versus a non selective. So selective beta blockers, those are the names over here. Atenolol, which is extremely common and ends with OL. Non-selective beta blockers. It's not exactly targeting one specific type of beta blocker, just going to target them both. Okay, and it also ends with OL. So when you have a patient, this is why it's important to know whether it's selective or non-selective. If you have a patient who's taking propranolol, okay, you know that it's non-selective. So what it's going to do is going to, it's blocking the contraction of the muscle, but it's going to also contract the lungs. Okay, I probably won't give them any problem breathing, but you just need to know this mechanism. Now, one thing we have to be really careful is that when we have a patient who is taking a beta blocker, okay, anything that ends with OL, immediately in your head, I want you to think, oh, I can only give them 0.04 milligram of epinephrine. Now, the reason for that is because the blood is already constricted. Epinephrine is going to constrict them even more, and you don't want to do that. Now, how many cartridges does that translate to? That's usually about 2 cartridges, depending on which dose or which concentration of drug you're using. But if it's 1 to 100,000, which is kind of lidocaine 1 to 100, which is the gold standard, they call it, is about 2 cartridges, okay? Alright, so beta blockers are all also used for all of this: arrhythmia, angina pectoris, myocardial infarction, and anxiety management. Now, the reason for that is, our body is completely connected. It's not just the heart or it's not just the brain. All of those are connected. But, you feel the way your body feels. Your emotions are attached to your body. So let's say your heart is a little less contracted. Okay, and because of that, obviously you're gonna get less angina. Angina is tightening of the chest. Okay, that's chest pain relating to blockage of the heart arteries, and same is myocardial function, which is death of some blood vessels in your heart. But think about anxiety. If your body is tense and if your heart contracts a lot, it pumps fast, it makes you feel anxious. Therefore, you are anxious. So by reducing that, you are feeling better. That's why it is used for many other conditions as well. So you can see that one drug's action pharmacology is used for many different purposes. Now, calcium channel blockers, and we saw California pine, so things that end with pine. Over here you have some examples. They prevent calcium from entering the heart and blood vessel. Now, so if you remember, so calcium is for construction generally. That's why when you have less of that, then you are able to open up the blood vessels. One side effect really important is gingival hyperplasia. That's why I'm taking my red to highlight this part. Gingival hyperplasia. So think about calcium, okay, or channel blocker. What I do actually is this: I put a C and a C, and I put them together like C and a C. It gives me like a round thing, and this gives me a clue for round gingiva, which is gingival hyperplasia. So think about enlarged gingiva. That's what you're gonna get with calcium channel blocker. ACE inhibitors. So I hope you watch again the video because it does an awesome job explaining all of this. But basically, again, there are many keys and there are many doors. So it inhibits opening of, in this case, that enzyme that produces angiotensin 2, because angiotensin 2 is related to narrowing the blood vessel. So it locks the door that leads to the next door, basically. That's what it is. And one of the side effects is dry cough. Now, how do I remember dry cough? Well, I can say, okay, do you remember we said ACE? Well, we learned it by doing something krill, and that leads to April. In the month of April, we have a lot of allergies going on with the flowers, and that can give you a cough. How about that? So think about a dry cough. All right, or you have an ace and you're playing some cards at the casino or with friends, and you're just trying to bluff, and you just give this dry cough to make think that you have nothing or you're losing. In fact, you're doing awesome. All right, A or B, angiotensin receptor blocker. Again, it's targeting the angiotensin 2. However, it is inhibiting the actual action of angiotensin 2 versus inhibiting the production of it. That's different, right? So we're blocking it. Things are made already, but we're just trying to not, block them. It's like football. You're just blocking them. The soldiers are there, the players are there, but you're blocking them. So that is angiotensin 2 receptor blockers, and they end with 10. So those were the hypertension drugs, the main hypertension drugs. Now, some heart conditions that we still need to know are anti-anginal agents, which dilates the blood vessels, okay, makes more oxygen flow to the blood muscles. And they're taken sublingually just because I explained earlier, when you take it and your GI tracts is very acidic, it processes everything, including your food, it breaks them in million little pieces. But when you take it sublingually, it goes straight to your blood. That's what you want. So when you have a patient who is having angina, give them the drug, crush it, put it under their tongue. Congestive heart failure. We learn about this in medical conditions. So if you don't know those conditions, please go back, because I think the basic of pharmacology is understanding the connection. So basically, there's a blockage in the arteries in the heart, and you want to just help with that. So the drug that is commonly used is called digoxin, and it increases the force of contraction. Okay, because some are effective, there's some congestion going on in there. The side effect of that is gag reflex and salivation. Now, this is how I memorize drugs: their brand name and the genetic name, right? So digoxin, all I'm taking here is the DIG, and linoxin, I'm taking lane. So I'm thinking about digging. When there is traffic, there's like so much congestion, you can't even go. Those are cars. You're just digging yourself a lane on the side so you can go faster. I know this is not realistic. This is just an image that I have in order for myself to remember the drug better. You do it once, you're gonna be so much better when you do it again and again and again. And we are always cautious with epinephrine whenever we have a patient who have some sort of heart condition. All right, so arrhythmia, when your heart is not beating at the normal pace. Now, I'm not going to go into the heart chambers and all of that, but what you really need to know is that there are many different drugs that actually you can take in order to help arrhythmia. Now here, there's beta blocker, calcium channel blocker, lidocaine. Now, how do I remember all of those three drugs? Because there's so many. You're going to have another 100 drugs to memorize. So all I did is B, like beta blocker, C, like calcium channel blocker, lidocaine, L. And I put them together. I said B, silly, but like be silly. Okay, so arrhythmia is a silly heart rate. So when you think about arrhythmia, when you see a drug that is a B, silly drug, whatever that is, you can think, okay, it's not just that the patient might have hypertension, the patient might also have arrhythmia. Does that make sense? So this was a wake-up memory. So I invite you to just keep using things like that. You might think, Claire, this is too much. I think this is something that's not really dental related. I don't know why we should learn it this way, but I promise you, once you start doing it, it's going to be easier and easier. And the things you're going to actually remember when you go to the board examinations are going to be things like this. So now let's talk about anticoagulant agents. This is the last one in our pharmacology relating to the blood vessels. Now, coagulants, well, there's a clot in the blood, and we maybe open the blood vessel using this mesh that is called the stent.